roles and practices that nursing practitioners undertake. This presentation outlines the roles and practices that nursing practitioners undertake and the review of their basic concepts in their various practitioners' roles. In addition, different practices from research and findings designed based on the statistics, types of variables, the criteria used in the study scales and of measurement, and different modeling techniques. Evidence-based practice. Evidence-based practice was formed and introduced in 1992. The role of an evidence-based practice has become inevitable, even in the areas rich in physicians' functions and hence spreading to other professional-related fields, including dentistry. It also provides a comprehensive and full range of primary healthcare services, information science. Evidence-based practice has been primarily referred to as being a three-leg tool with an evidence level of integrating different healthcare basic principles. Evidence-based practice. These includes noted research evidence from the analysis showing how the treatment works and why it works. Clinical study and the findings from the expertise with an aim of identifying each patient health status.
Carolyn, please speak louder. Your voice is low. Please speak louder.
And lastly, the client-related preferences regarding his or her values. It has evidence to prove the best option as per results. How practitioners generally outlines the importance of values while carried out to these affected and performance of those who will be affected. This is done in a way or as a manner that it will enhance capability with the surrounding environment, relations, and organizational impacts content. This entails the collection of samples of data through observation, analysis, and classifications through innovative concepts regarding to the identification of the formulated means of highlighted processes of the questionnaires and testing of analysis of hypothesis area tests. As been outlined by Lackerville, Glunty, and Rutter 2016, it entails the importance of making proper decisions about and on how to improve and promote health care or provide enhancement care through integrating the best excellent care services needed. The research process. This research process enhances the capitalization of the overall research study outcomes, which includes analyzing survey data, communicating results. The purpose of carrying out the research is to enhance and develop the use and derive an empirical know-how discipline or profession. After carrying out the research process, one can provide a foundation regarding the medical practices, regarding the decisions and behaviors, aspects that are laid. Relatively, the process, analysis, and the findings from the research enable someone to create the high medical and scientific base in the nursing practice. Nursing research process. The critical purpose of each research process made or executed is to develop and empower an empirical body with intended knowledge within a particular profession. Additionally, research validates and empowers the end user with refined and intended experience. And the graph shows the nursing process, the assessment, the nursing diagnosis, the planning, the implementation, and the evaluation. Research approaches and design. Research problem 2, theoretical and conceptual. The sampling tool and methods of data collection. Implementing research plan. Reporting and utilization of research. Primary methods deal with the collection of data materials, while secondary methods deal with the analysis of the findings. Research problem 2, one of the research priorities as it is being outlined by Anhazit, Proverbs Anomaly, 2008, is to identify the problem at hand leading to research being conducted and eventually identifies the key prime variables that leads to the information relating to the scope of the research study. Theoretical and conceptual. There is a great importance for one to consider the relevant fundamental theory that enables and brings about the knowledge regarding basis of the phenomenon that can be researched. Initially, during the research work preparations, it eventually leads to the conceptualization and identification of several factors that are ultimately likely to have the initial impact on the outcome. Sampling tools and methods of data collection, implementing research plan, reporting and utilization of research. Sampling, a process of selection, classifying and analyzing data. This data is subdivided into sections and subsections for an easy understanding in relation to what was done. Implementing research plan data analysis module can be implemented in health fraternity where the results of the research can be applied and be of great benefit and importance. Relatively, when research is carried out, acts as a benchmark to counter the future and problem at hand. Reporting and utilizing of research. Stated by White and Fortune, 2002. After the data has been analyzed, it is then reported in health sectors and related relative fields and stored for future reference. It is then utilized when needed in case of the related occurrence that might be repeated.